Health officials are also using this time of year to remind people of the importance of mental health. The American Academy of Pediatrics is now encouraging routine suicide screenings in adolescents, despite the National Task Force calling for more research. Isabel Garcia spoke with a local expert on children's mental health to learn more about all of this. She filed this report this evening.
Last fall, the American Academy of Child and Adolescent Psychiatry, along with the Children's Hospital Association, declared a national emergency in children's mental health. They cited the serious toll of the COVID-19 pandemic on top of existing challenges.
The rates of depression, in particular among teenagers, have gone up dramatically, and that actually even precedes the pandemic. We've seen rates of anxiety disorders go up as well, and those have clearly been exacerbated by the pandemic.
This past spring, a national panel under the U.S. Preventative Services Task Force recommended screening for general anxiety disorders for all children ages 8 to 18. Screening for depression is being recommended for those ages 12 to 18. On suicide risk, however, the task force concluded there is insufficient evidence to weigh the benefits and harms of screening asymptomatic children and teens.
The reason to do it anyway is because asking a couple of questions, there's also no evidence that it does any harm. And if you can discover a risk for suicide in a youth who, up to that point, you as a clinician or family members are unaware of, you can really save a life.
In the meantime, when it comes to noticing signs or how to start a conversation with your child to check in on their mental health, URMC's Dr. Michael Scharf advises to approach with curiosity and gentleness.
What I'm really encouraging, though, is when you notice something, don't let it go. Again, if it's not an obvious crisis, you might not address it that minute. You know, if a kid looks different at breakfast, you don't have to drop everything and stop everyone's day. But remember it, and then see how they look at dinner, and, you know, check in and really try to understand what's driving the difference.
Isabel Garcia reporting there. Dr. Scharf also adds, parents have the special ability to truly know their children more than any doctor or specialist can. He encourages parents to trust their gut, and if they're ever unsure, ask a primary caregiver.